Testing, hygiene measures, vaccinations, organisation. The pandemic has presented new challenges to people all over the world. For many of these problems, there were no standard solutions. A lot of time and effort went into implementing new ideas. In this programme, we show how scientists, inventors and ordinary people found ways to make the best of an unprecedented situation. Like in Spain, where researchers have designed an intelligent FFP2 mask with an alarm function.
Since the pandemic outbreak in early 2020, masks have become an indispensable ally in preventing the spread of COVID-19. But in spite of the evidence in favor of them in reducing community transmission, people who have to wear a mask for hours on end agree that it's not always easy.
Some days, especially at the start of the pandemic, I had a headache and felt drowsy. Since you can't breathe as well and you're working all day, you may get more tired than usual.
The CO2 concentration between a person's face and an FFP2 mask is higher than usual because the air that's exhaled gets trapped. Inhaling this carbon dioxide can lead to health effects, such as headache or fatigue.
When I wear the mask for a long time and it's busy, I get tired and my nose and throat get dry. I have to run to the kitchen, drink water, breathe a bit, and get back to work.
To help mask wearers avoid these issues, a multidisciplinary research team made up of engineers and chemical scientists from the University of Granada has developed an intelligent mask that alerts wearers on their smartphones when recommended CO2 limits are exceeded.
The intelligent mask has a sensor, meaning a way to measure something in the air between your face and the mask. So this CO2 sensor is equipped with the electronics that will measure the color change in the sensor and transmit that information to a smartphone.
So a standard FFP2 mask can be turned into an intelligent mask that monitors gas concentration by placing a special electronic sticker inside the mask.
The sticker inserted inside the mask is a system that consists of two parts. On one side, there's what's called readout electronics, which is printed with conductive ink on a flexible plastic and transparent substrate, as you can see. On the other side is the chemical part of the sensor that changes its color depending on the CO2 concentration.
To notify users if they've reached the recommended CO2 limits inside the mask, the research team has designed a special mobile app.
The user has a mobile app to read the carbon dioxide concentration. With NFC technology, the same technology used for wireless payments, users would simply have to hold their smartphone close to the mask. It automatically detects this sticker and reads the CO2 concentration inside the mask. The software alerts users through a traffic light display, red or green, if they need to ventilate.
Although mask mandates have been lifted in many countries, many workers are still required to wear them. So the researchers believe there's a demand. The team is willing to transfer the technology to any industry that may be interested in it.
Alongside masks, coronavirus tests have become our constant companions, whether a quick test at home, a lollipop test at school, or a PCR test analysed in a lab. But even with an extensive testing infrastructure, some people get tested less often than they should. They don't have a test kit, don't have time, or just don't want to. But there is a way to test everyone all the time, and without anyone even noticing.
This is wastewater. It comes from Saarbrücken in western Germany and is purified at the largest sewage treatment plant in Saarland. 25,000 cubic meters of wastewater on dry days, enough to fill more than 130,000 bathtubs, though in rainy weather, that amount can triple. Tina Vollertun conducts wastewater analysis. Recently, she's been checking sewage samples for the coronavirus, believing that this could be a better way to detect rising infection rates than COVID test results.
The advantage of monitoring wastewater is that it gives us data on everyone who's infected, since everyone has to go to the toilet. And everything we excrete ends up at the sewage treatment plant. Since we get human waste from everyone in the plant's catchment area, we can also find fragments of the virus that infected people excrete into the wastewater. So we can catch unreported cases too, as not everyone knows that they're infected or gets tested.
The sewage at the treatment plant is already tested for harmful substances, nitrate concentration, and pH value. An autosampler collects a bottle every 2 hours. Benjamin Wolf examines the samples at the same time each day. An extra sample is now taken twice a week for the coronavirus monitoring pilot project.
This bottle is for our coronavirus sampling. The larger bottle is for our sampling, our daily checks. And this large bottle will be kept frozen for a month, so we always have a reserve sample.
Almost 2 years ago, Susanne Lachner from the Technical University of Darmstadt found that sampling wastewater can show how quickly and widely coronavirus has spread through a region. Back then, she and her team were searching for an early warning system for COVID-19 waves and found it in wastewater. Her method could even detect how quickly different variants of the virus were spreading in a given area.
The data could be used to estimate the infection rate in the plant's catchment area and decide whether to do more COVID testing or less, and whether to relax COVID restrictions, depending on wastewater values.
Many countries, including the Netherlands, Spain, and the US, quickly adopted the system, in part because it's cheaper than conducting hundreds of thousands of individual COVID tests. The Darmstadt researchers offered their services to nearby Frankfurt too, but its health department declined, as did authorities in other German cities.
It's really a pity. We tried to speak with the health department, as we feel this data is very sensible and useful, but it went nowhere. We're not doing this for ourselves. We want to share this information with the authorities and health department to help fight the pandemic, and that requires communication.
So now there's a cheap and effective system to monitor COVID waves that's being used internationally. Yet many German authorities have chosen to ignore it. Friedrich Hetzel deals with safe and sustainable water management. Can he explain this refusal?
Maybe it's due to our way of thinking. Wastewater monitoring provides a trend analysis. From wastewater analysis, we don't get any numbers where we can irrefutably say that, for example, in the catchment area of a sewage plant, 1,000 of a city's 50,000 residents are currently COVID positive. That's why health authorities initially said, we don't want to rely on these trends when it comes to making predictions and implementing measures.
Now, 20 German municipalities are taking part in the wastewater monitoring pilot project. Even more had applied to do so. Currently, the wastewater samples from across Germany that are being tested for the coronavirus are sent to a central lab by mail. It's hoped that eventually testing could be done on the spot. Then the results would be available even more quickly.
Masks, tests. Many times during the pandemic, we were faced with issues for which we had no off-the-shelf standard solutions. New ideas were needed. Around the world, inventors set to work to help themselves and others. Our reporter Lars Halter spoke to Professor Doug Hanna from Boston University about some of these solutions, including a DIY air filter from the hardware store.
Professor Hanna, the pandemic threw a lot of problems at people, especially those in government positions and in institutions tasked with keeping people safe. And solutions were sometimes hard to come by, but there seemed to be a handful of inventors that came up with pretty smart ways to help. We found one particularly interesting, the Corsi-Rosenthal box for air filtration. Can you tell me a little bit more about that?
Yeah, absolutely. So the Corsi-Rosenthal box is at its core, it's just essentially 4 filters taped together with a fan. And the goal is to provide a boost to ventilation and filtration. I actually have an example here. This is a sort of smaller version than is typically used, but it's, as you can see, it's 4 filters, some cardboard tape, and a fan on top. What is really neat about this is it is about $60 to $80 in supplies. It takes about 30 minutes to make. It can be adapted based on what's available in a local hardware store. But once you have one, it can provide a really substantial boost to ventilation.
Your team has built up a whole database full of interesting inventions, all related to the pandemic. Which ones did you find particularly interesting?
Yeah. So my team has been tracking hundreds of organizations that cropped up all over the world to address the sort of social and economic and human health impacts. And some of the inventions that they've created have been just absolutely wonderful. There were things like intubation boxes, which protect doctors and medical personnel from aerosol contamination when putting patients on ventilators. There were low-cost oxygen concentrators. There were all manner of different masks and respirators made out of whatever locally available materials there happen to be, UV disinfectant chambers for reusing and sterilizing personal protective equipment, and hundreds or thousands of other hardware inventions. There were also really neat social innovations, and I think for me, some of the ones that stand out the most are all of the effort and the sort of clever thinking that went into organizing people who were remote during a pandemic to work together to accomplish things. So, for example, there were groups that got together to organize these sort of complex supply chains to locate professional grade N95 masks that were in people's homes and get them and redistribute them to hospitals to where they needed to be. Similarly, there were groups that designed masks, tested different mask materials, pre-assembled kits, and got them out to home sewists who could make masks and then again get them to frontline staff. And the sort of human organizing aspect there is not trivial. It's a really difficult thing to do in the best of circumstances, and this was during a pandemic. So even though we often think just about those hardware solutions, there was a tremendous amount of ingenuity just getting everyone to work together under really difficult conditions.
Now, some of these really smart solutions could not really be used by hospitals or schools because of rules and regulations. Has the process held up progress in fighting the pandemic?
So there's a real difficult challenge here. We need rules and regulations. When we're talking about people's health, we're talking about medical devices and medical settings. We need rules and regulations to make sure that our treatments and our devices work, that they're manufactured correctly, that they're stored correctly, everything like this. The challenge, though, is that in a pandemic, you also do need to move fast. And in this sense, rules and regulations did, in many cases, pose a big impediment to people who were trying to get in and help. So we saw hospitals, for example, that were not able to accept donated personal protective equipment and thus had to do without. We similarly still actually see schools turning down ventilation boxes and filter boxes like this. So on one hand, these regulations matter, we need them. On the other hand, they absolutely do become a source of inflexibility when we need to move fast in a pandemic.
Professor Hanna, thank you very much.
Thank you.
New ideas are also important as we find ways to live with the coronavirus into the future. Keeping distance and wearing masks don't seem like long-term solutions because a large part of the population is already against the idea. Now, researchers in Finland are working on a nasal spray that can be used easily as needed to block the coronavirus.
It's 9 a.m. in Finland's capital, and these young researchers are already immersed in their work. In this lab at the University of Helsinki, they have joined the global race to end the pandemic caused by the novel coronavirus. However, their weapon in this fight is not a vaccine, but a nasal spray. So far, their project looks promising.
The aim is to provide short-term protection. So in preclinical studies in animal models, we have gained strong protection against viral infection when we have applied 8 hours before the inhibitor and also even 4 hours after the infection.
Anna Mäkelä and her team say their research shows the spray protects against COVID-19 variants such as Omicron and Delta. The innovation could be especially helpful to high-risk groups.
There really is a need for complementing applications in addition to vaccines. I have to address that this is not meant for replacing vaccines, but to complement their action.
The Finnish nasal spray does not remove coronaviruses, but inactivates them with a blocker. It forms a protective shield in the airways. When coronaviruses enter the nose and mouth, the molecules of the spray block the spike proteins of the virus from taking hold. Pharmaceutical companies around the globe are following the development of new coronavirus drugs carefully.
At the same time that vaccines started to be developed, companies began looking into drugs to treat COVID-19 related symptoms. As with this nasal spray study, the underlying research is often prompted by the researchers themselves, and only later do companies join as partners. But right now, we think that vaccines are our number one tool to exit the pandemic.
Finland has one of Europe's highest vaccination rates, with over 77% of the population now fully inoculated. This includes adolescents over the age of 12. There's a national recommendation that they get the jab. Like many other countries, Finland has started to gradually lift remaining COVID-19 restrictions in the hope that the Nordic nation could soon return to something resembling pre-pandemic life. If all goes well, the Finnish nasal spray study will move to clinical trials this autumn. But it will take months, if not years, to determine whether the spray works efficiently for humans. Meanwhile, Mäkelä and her team will continue their work. They're trying to get their nasal spray labeled as a medical device rather than a new drug to fast-track its approval.
Our science reporter Derek Williams has been following what scientists and researchers have been doing during the pandemic, and as always, he's here to answer your questions. This time, Elise H. wants to know what's happening with vaccines that can be given via nasal sprays.
The more than 20 COVID-19 vaccines that are currently approved for use in some part of the world induce immunity in a variety of different ways. But they all have one thing in common, which is that they're injected into a recipient's muscle tissue with a needle. The body's immune system, therefore, learns to recognize SARS-CoV-2 not where it would ordinarily encounter it first, in the eyes or the nose or the throat, but in the upper arm. The shots provide fundamental systemic protection, but they don't prevent future infection entirely. Breakthrough infections in vaccinated people have grown common since the onset of the Omicron variant. Some experts think that to make the immune system better at preventing infection and transmission, we need to develop vaccines that train what are called your mucosal cells to recognize the virus. Mucosal cells are the cells that line the upper reaches of your respiratory tract. So it's the first place that your insides come into contact with any viruses that you might inhale. And the best way to train those cells, so the theory, would be with a vaccine that's sprayed or inhaled rather than one that's injected. In the past, researchers have tried to design intranasal vaccines for other respiratory diseases, like influenza, but they're challenging for a couple of reasons, so success has been pretty limited. One problem is that to get the desired result in mucosal cells, nasal vaccine developers often choose to use what are called live attenuated viruses, and it can be really pretty tricky to get the levels of those just right. And because your nose is a lot closer to your brain than your upper arm is, if there's an inflammation or other problems caused by the vaccine there, then it's kind of by definition a more dangerous situation. That said, I do think that intranasal vaccines will eventually play a role in controlling the current pandemic. But what I think will have an even bigger impact long term is the groundbreaking research into this type of technology that was driven by COVID-19, which could theoretically be deployed to fight other respiratory diseases in the future.
Thanks to the pandemic, working from home is now part of everyday life in many parts of the world. For large and small companies, this meant upgrading computer systems, new software. Many young people saw a huge opportunity and learned to code, to write programs for the new world of work. In Nigeria, many responded quickly, and this entrepreneurship opened professional opportunities, including with some international companies.
Work on his own terms. Before the pandemic, Dare had a regular 9-to-5 job as a software engineer in a Nigerian company. That required him going to an office every day. But now he works remotely for a company in Europe, making what he made in 1 year in a single month.
The pandemic, like I would always tell my friends, like it's like a blessing in disguise for me, to be honest, because like I said earlier, like I never thought I could work remotely. I never envisaged that, to be honest, until when the pandemic happened.
2 times a week, Dare meets with a small group of fellow software engineers called Polytope Labs. They come together to learn the latest software technology. They all have remote jobs, but they also want to be part of what they believe is the future of tech. Seun Lanlege is the founder. He says software is Africa's new oil.
You know, we have a lot of people here. We have a lot of bright minds here. It's the only like opportunity for us is to train these minds and make them relevant on like the global stage.
Members of Polytope are part of a small pool of Nigerian senior software developers that are in high demand all over the world.
So due to the pandemic and because most companies were forced to start working remotely, most companies now come to understand that you really do not need your people to be in the office. So it has really expanded the opportunities that are available to talents down here, and it has also opened our eyes to see what are those necessary skills we need to start having, we need to start building ourselves on, such that we can now tap into these global opportunities and everybody's happy.
Rita Achebe is a talent recruiting manager at Talent QL. Talent QL was created at the start of the pandemic to match African tech talents with international companies. Rita says that they receive requests from about 100 companies every month for senior developer roles. But many times it's difficult to fill these roles because most software developers in Africa don't have the relevant experience, so they are not able to take advantage of the vast opportunities available. In order to close this gap, Talent QL recently launched a digital academy called Alt School.
First off, we start by deciding what does the market, what are the skills out there that people are hiring for, because it doesn't make sense to educate people on skills that are not needed out there. That is what some of our traditional institutions do.
Now let's talk about
All the lessons for Old School are recorded in this studio and then uploaded to the online learning platform. Around 8,000 people from 20 countries applied for the program. 6,000 got in. The goal is to train 1 million Africans in 5 years. If the African tech scene continues with its current momentum, tech talents could become the continent's biggest export.
The coronavirus pandemic has presented us with huge challenges, and we've responded with innovations and initiatives big and small. Maybe you also have an idea up your sleeve. Then bring it on. Even the smallest things can help overcome big crises. Next week, we look at the economic fallout of the pandemic. So, until then, goodbye from us, and see you soon.